My name is Jennifer Puente. I'm a student at the University of Memphis. I will be conducting my head-to-toe examination on my son, Skylar. It is Sunday, January 15th, 8:08 p.m. I will begin by showing you the entire room, top to bottom. There's our Snellen chart. Here are all my supplies. My son here will be helping adjust the camera as we do the lower body exam. This is our bed. I will begin my head-to-toe examination with an overall examination of the skin of his anterior and posterior chest, abdomen, bilateral upper and lower extremities. His skin is warm, clean, dry, and intact. I do not note any erythema, edema, swelling, nevus, scars, lesions, burns, or scabs. I will begin examining his head. His hair is black and soft. I do not note any infestations or bald patches. Palpation of his skull, any tenderness there?
No.
Good. Skull is intact. His head is normocephalic, midline of his body. Examination of his temporal arteries. Any pain there?
No.
Good. Temporal arteries are within normal limits. I will examine his lymph nodes, pre-auricular, post-auricular, tonsillar, occipital, submandibular, submental, anterior cervical, posterior cervical, and supraclavicular. No noted abnormalities with his lymph nodes. I will assess for TMJ. I'll have you open and close your mouth for me. No subluxation or tenderness with that. I will also assess cranial nerve 5, which is the trigeminal nerve. I will have you clench your jaws for me. Any tenderness there?
No.
No noted tenderness or abnormality with that. I will also assess the sensory portion of cranial nerve 5 by having you close your eyes and tell me whether you feel a soft or sharp touch.
Soft. Sharp. Soft. Sharp.
Cranial nerve 5 is intact. You can open your eyes for me. I will now move on to examination of his ears. I will palpate both the pinna and the tragus for any noted abnormalities. There are no noted abnormalities. Earring in one ear, not in the other. It is pierced, however. I will also be testing cranial nerve 8, which is the acoustic nerve, with the whisper test, as well as Rennie and Weber. With the whisper test, I'll ask you to repeat after me.
ABC.
And again.
1, 2, 3.
Good. Whisper test is normal. I will examine his tympanic membrane. His tympanic membrane is pearly gray, translucent, with cone of light noted. And again, pearly gray, translucent, with cone of light noted. I will utilize the tuning fork to conduct the rest of the examination. I asked, do you hear this equally in both ears?
Yes.
Weber test is normal. Tell me when you no longer hear the vibration.
No. No.
Air conduction should be greater than bone conduction. Tell me when you no longer hear the vibration.
No. No.
Good. Again, air conduction greater than bone conduction. Normal acoustic nerve examination. I will now move on to the examination of his eyes. I will ask that you remove your glasses for the first portion of this examination. I began by an overall look at his eyes, and eyebrows as well as palpable fissures. I will also check his sclera, open for me, and conjunctiva, sclera, conjunctiva, pink, moist. Eyes appear normal, iris is normal. I will also be checking cranial nerve 2, which is his optic nerve. I begin that by having you to look out in front of me, and I'll have you cover your right eye. Good, and tell me what numbers you see me holding up.
2, 4, 1.
Good, and cover your left eye. Same.
2, 4, 1.
Good, and I also will be, go ahead and open your eyes. I'll test his central and peripheral vision at this time, as well as cranial nerves 3, 4, and 6, which are oculomotor, trochlear, and abducens. Testing of those nerves involves the assessment of his peripheral vision and central vision as stated. We also will utilize a Snellen chart, which I have there before us. I'll have you cover your right eye. Tell me when you can see my fingers.
No.
Good, and cover your left eye. Tell me when you can see my fingers.
No.
Good, and I'll have you focus out there. I'll test accommodation and convergence at this time. Just look straight ahead. Convergence is normal. I will now check his pupils. Normally you would dim the light for this. I just covered his eyes a little. His pupils are normal, 3, and regular. I also will test and look at the inner structures of his eye. Look straight ahead for me. I don't note any woolly bodies or abnormalities. Optic disc is sharp. Eye appears normal. We will now conduct the Snellen chart exam. With no glasses on, I'll have you cover your right eye for me and read the largest line that you can read.
None.
And your left eye.
None.
Okay, go ahead and place your glasses on for me and cover your right eye and read the largest line that you can read.
FPH.
And your left.
FPH.
Very good. And with both eyes.
DHJBS.
Good. I will now begin the examination of his nose. I will be testing for patency of his nares, as well as palpation of his maxillary and frontal sinuses. Any pain or tenderness here?
No, ma'am.
Pain or tenderness here?
No, ma'am.
Good. I'll have you close your eyes and tell me what you smell.
Chapstick.
Good. And again here.
Sharpie.
Good. This is testing cranial nerve 1, which is his olfactory nerve. I'll have you to hold down on one side of your nose. Breathe in and out. Good. And in and out. Good. Normal patency of his nose and olfactory nerve are present. I will now examine his mouth. I am looking at his lips. I'll have you open your mouth for me. Gums, teeth, and all items within the mouth. I will have you to open up and say, ah. Good. Tonsils are present in grade 0. I'll have you lick your tongue out for me. Normal rise and fall with his uvula was noted with phonation. And you move your tongue to your right, left, up, down. Good. That also tests cranial nerves 9, 10, and 12, which are his vagus, glossopharyngeal, and hypoglossal nerves. They are all intact. I will now move on to the examination of his neck. No abnormalities noted outwardly. I will stand behind him and examine his trachea. It feels midline. I'll have you lean to the right. Swallow. Good. And to the left. Swallow. No tracheal deviation noted or any abnormalities felt. Good. While here, I'll also palpate carotid pulses one at a time. Good. Good. I will also listen for carotid bruise with the bell of my stethoscope. Good. Good. no noted abnormalities there. I will now begin the posterior chest examination. I will turn him around so that you can see there are no noted tripod breathing or abnormalities. Take a good deep breath in for me and out. Good. Chest expansion, rise and fall appear normal. I will begin by testing for and listening to his lung sounds. I'll check bronchophony, ergophony, whisper pectoriloquy, as well as tactile fremitus. I'll have you say 99 when you feel me touch.
99, 99, 99, 99.
Good. I'll listen to all lobes of his lungs with both the bell and the diaphragm of my stethoscope. Ensuring that I get medial and lateral lobes. I'll have you whisper E when you feel my stethoscope.
E.
Good, and I'll have you whisper 99 for me.
99, 99, 99.
There is no noted abnormalities with whisper pectoriloquy, bronchophony, or ergophony. I will now percuss in his intercostal spaces. Resonance will be heard throughout. I will now turn him around and begin the anterior chest exam. I will begin this exam by again listening to his lung sounds again. Also checking again for tactile fremitus. Listening with both the bell and the diaphragm. Some good deep breaths for me. Ensuring again to get medial and lateral lobes. I'll have you whisper E for me. All right, now I'll have you whisper 99 for me. 99. I'll have you say 99 when you feel me touch.
99, 99, 99, 99.
No noted tactile fremitus, no ergophony or bronchophony noted. I will now begin the percussion in between his intercostal spaces again. Again, resonance will be heard throughout. I will now begin the cardiac portion of his exam, listening to the valves of his heart. I begin at the second right intercostal, listening with both the bell and the diaphragm. Aortic, second right. Pulmonic, second left. Third left, Erb's point. Fourth, tricuspid. And fifth, next to the medial line, mitral. I will listen here for 60 seconds to obtain an apical pulse. His heart rate is 70 and regular. We'll now palpate PMI. No noted heaves or thrills or abnormalities there. I will have him lay down where I will conduct the listening of his heart valves again. In examination, I also will note there's no JVD at a 45-degree angle. Listening again to the heart valves. With both the bell and the diaphragm. I will also palpate over all of these points, noting no abnormalities, heaves, or thrills. Also again palpating PMI. I will now begin the abdominal examination. I will inspect, auscultate, then palpate. Inspection reveals his abdomen to be flat. No noted abnormalities. Chest rise and fall and expansion appear normal as well. Beginning in the right lower quadrant, listening to his bowel sounds. He has bowel sounds present times 4 quadrants. Now you take a deep breath in for me. Good. And again. Liver and spleen exam are normal. No noted abnormalities there. I will also listen for breweries in his aorta. As well as his iliac, renal, and femoral arteries. No noted breweries there. I'll have you get back on the stool here. Face the wall. Check for CVA tenderness. Any tenderness with that?
No.
No CVA tenderness noted. I'll go ahead and have you spin back around. Take a deep breath in for me. And out. Again, further proving normal rise and fall and chest expansion. I will now conduct my musculoskeletal exam. I will be examining the joints of the shoulders, elbows, wrist, hands, knees, hips, toes, and feet. I also will conduct a skin examination at this time as well. There are no noted abnormalities. I'm going to be checking his joints for any crepitus, edema, subluxation, clicks, or locks. I will begin by checking radial pulses. Radial pulses are 2+ and normal. I will also check capillary refills. Capillary refills are less than 3 seconds. I will check dorsalis pedis pulse. Good. 2+ and normal. Also checking capillary refill. Capillary refill again is less than 3 seconds. I will now check for flexion, extension, adduction, and abduction in both his hands, elbows, and shoulder, as well as strengths. So I'll have you squeeze my hands. Strength in his hands are 5 out of 5. Can you push against my hands? Good. And pull upward. Good. And strengthen his wrist again, 5 out of 5. Hold your arms up for me and pull. Good. And push. Good. Elbow strength 5 out of 5. Can you make muscles for me? Good. Push up. Good. And pull down. Good. Shoulder girdle strength is 5 out of 5. Can you push against my hands? Good. That tests cranial nerve 11, the accessory nerve as well. I'll have you to bring your hands out in front of you, make a fist, flex, good. Open them up, extend, good. And I'll have you down, flexion, good. Extension, and circumduction, good. I'll have you bring your hands in and out, ulnar and radial deviation. I also now at this time will have you to bring your arms out to your side, good. And make some circles for me, good. And bring them back down to your side, abduction and adduction of the shoulder. And I'll just have you kind of, good, good. Rotation. I will also check for stereognosis and graphessia. I will have you close your eyes for me. And checking for stereognosis, I will have you tell me what you feel in your hand.
A key.
Good. And in this other hand?
A paperclip.
Good. Keep your eyes closed. Tell me what you feel me draw in your hand.
An O.
Good. And here?
A.
Good. I also will have you to keep your eyes closed and tell me if you feel the sensation and touch of sharp or dull.
Soft. Sharp. Soft. Sharp. Soft. Sharp.
Good. He has normal sensation in his extremities. You can open your eyes now. I will also check the vibratory sense. Feel the vibrations?
Yes. Yes.
Vibrations?
Yes. Yes.
Good. I also will check his deep tendon reflexes before finishing my lower extremity exam. I will test his radial, bicep, tricep, Achilles, patellar, Achilles, and his Babinski. Good. And again on the opposite side. Brachial, radial, bicep, tricep, patellar, Achilles, and Babinski. Good. I will now have you to invert and evert your feet. Bring your feet in. Good. And bring your feet out. Good. And I'll have you turn your toes inward for me. Inversion. Good. Eversion. Good. Can you bring your feet up off the floor and dorsal flex, plantar flex? Good. And the other foot down and up. Good. And can you spread your toes out for me? Good. And grip your toes together. Good. And can you just kind of make some circles? Good rotation of his ankle. I'll have him stand and I will examine his knees. Bring your leg up. Good. And down, up, down, flexion, extension or normal. Bring your up and out. Good. Lateral rotation of your hip. Good. And out. Good. Lateral rotation. I will also have you lean right. Good. And left. Good. And forward. Good. And hyperextend back. Good. Very good. And I'll also have you close your eyes for me. Put your arms out to your side. Any dizziness? This is the Romberg test. It is normal. Bring your hands back down to your side for me. Open your eyes. I'll have you take some steps that way. I don't note any abnormalities with his gait. I'll have you make heel to toe steps forward for me. Doesn't appear to have any trouble with balance or posture. All right, and I'll have you to hop on one foot and the other. Good, and can you bend down and touch your toes for me? Examination of the spine and curvature of the spine reveal no scoliosis or abnormalities there. Good, sit up for me. That conducts my head to toe examination for 2023.